From government office worker to hospital playroom champion, Minwoo's journey shows how theory and undergraduate classes might be your secret weapon when supporting children across cultural boundaries. Professionally Psyched is the podcast that brings you cutting-edge psychology research and real-world insights from our psych community of clinicians, researchers, and educators alike. In our special alumni spotlights, we chat to graduates from our psychology degree programs about how their skills learned in the classroom have become powerful tools supporting diverse career journeys and successes. Hi everyone and welcome to Professionally Psyched. I'm Jessica Muller, PhD candidate in Public Health at James Cook University, and before we get started we'd like to acknowledge the custodians of the land on which we record, and for me today that's the Bindal and Wulgurukaba peoples. And I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples and cultures from wherever you may be tuning in from across the country. In this alumni spotlight, Dr. Amanda Krause speaks with Minwoo Tan, a child life therapist at Singapore's Children's Cancer Foundation, who discovered her passion for hands-on healthcare after graduating from JCU. Minwoo reveals how those theoretical anthropology lectures became her daily toolkit when working with international patients. So grab your headphones and get ready to get professionally psyched about the unexpected ways your psychology degree can prepare you for emotionally challenging yet deeply rewarding roles in pediatric healthcare. Enjoy.
Mingri, thank you so much for joining me on the podcast today. To start, could you please introduce yourself?
Hi, my name is Mingwei. I'm a child life therapist at Children's Cancer Foundation in Singapore. I've been in this job for I think 6 years.
And did you enter that job straight away after graduation, or what was your journey to get to where you are today?
Actually not. I think upon graduation, I started as a temporary staff in a government office. I gained a lot of valuable experience in both groundwork and policy work. It involved a lot of administrative tasks, but I was fortunate to participate in focus group discussions and extended field work, which I think it is also part of our experience in James Cook. We focused on research. We learned about focus group. It was very helpful for me to carry out those focus group discussions in the public. Yeah. So I think through that experience, I also realized I was more drawn to hands-on direct engagement on the ground. I cannot sit still at my desk. Definitely. Yeah. So I think that realization combined with my growing interest in healthcare, it led me to my first opportunity in a hospital setting. Yeah, so when I was offered a role with Children's Cancer Foundation, I was super excited. Yeah, so I think not only because it aligned with my passion for groundwork, it gave me the chance to work in a hospital environment, which I have not ever imagined myself in before.
So that was something new. You hadn't necessarily thought, oh, I'm going to work in a hospital once I'm done with my education.
Yes, because before I studied in James Cook, I took child psychology as a diploma, and then I worked as a preschool teacher for 2.5 years. So I was kind of figuring out where to go. I didn't know what to do and whether opportunities arise for me or not. Yeah.
Yeah, but it sounds like you've gravitated towards working with children
Yeah.
across a number of different roles. Can you tell us a little bit more about what you do in your current role?
So I'm a child life therapist. I support children during medical procedures. So my role as a child life therapist under Singapore's Children Cancer Foundation, I support children from the point of diagnosis of cancer to whether they return back to the community or whether their diagnosis actually leads to palliative and bereavement care. Yeah. So I support for procedures, medical procedures, surgeries, try to decrease the amount of the stress that they get from surgeries, from procedures, advocate for them in front of the medical team. And then I think it's very important to advocate for children in spaces that can feel very overwhelming and very traumatic. Yeah. I also took formal education in child life, which actually covers a medical terminology, understanding trauma, death and bereavement support. They are very important for child life specialists to support children and families to navigate difficult experiences in a hospital. Yeah.
And I imagine you're not only working with a child, but also the entire family. Is that correct?
Yes. So at the point of diagnosis, each family is actually referred to a social worker and a child life therapist. So we work very closely in a team. And so the child life therapist usually focuses more on the child. We look at developmental areas. We look at what the impact of treatment it has on their psychological, social, emotional well-being. Yeah. So the social worker actually looks at the family as a whole. We strive towards family-centered care, and I think definitely trauma-informed care. Yeah.
Yeah, it sounds like it would be quite a lot going on for these children and their families. What have you found that you draw on from your psychology learnings at James Cook when you are working with these clients?
Interestingly, anthropology had a lasting impact on my work. Like I wouldn't think that would be the most crucial one, but because I support many foreign patients from different cultural backgrounds, I think anthropology really broadened my awareness of cultural differences, and it also taught me to engage with families that are like, how do I respect and integrate their unique differences? Yeah. So I have patients from Vietnam, Papua New Guinea, Australia, yeah, Malaysians, Thailand. I think that there's a very huge range of patients we see. Yeah, and then I think from anthropology, it helps me to learn how to build trust and ensure that my interventions are both meaningfully and culturally sensitive. Yeah, I think definitely another one that's very important is developmental psych. Yeah, developmental psych and health psych, because they were the most influential in shaping my understanding of how children process medical experiences at different developmental stages. Yeah.
And I wanted to pick up on something you said earlier because you made reference to in your earlier role being able to conduct focus groups and draw on that research understanding. What role does research play in your current work as a child life therapist?
We do have our own research team, but we also work closely with our research team on whether like long-lasting effects of treatment on children as they grow, as well as how they cope with returning to the community, how they cope with returning to work in the future. Sometimes cancer has a very lasting effect, or it has a physical impact on how they look, how they behave. So I think our research team is definitely working very hard towards exploring more of how these ends up. Yeah, how are these impacted? As a child life therapist, I think mostly we give feedback to our research team on how the child is coping, maybe from the start of diagnosis to the middle of treatment. Are they coping better in terms of our support? And then if there are anything that needs to be highlighted, the research team actually does. I think they do assessments, and then they give us the feedback, and then we can follow up on with the parents and family.
That's really interesting, and it sounds like you work with a lot of different people in your role, from other clinicians to researchers to the families themselves, as well as, I suppose, hospital staff and all sorts of different medical people. How do you find working with all those different types of professionals?
It's not easy. I think in the hospital environment, it's so fast paced, and rapport takes time, trust takes time. So I think it's very important to be open in communication, to really advocate for what we are doing. My typical perception of a hospital is a sterile, white walls, kind of thing, but and an overwhelming presence of illness. Like it would be dull and sad, but I was very surprised at how bright and welcoming the pediatric oncology department was. The nurses were friendly. The doctors are actually, they are very child friendly. The doctors are very concerned about the kids. They are not seeing them as just like cases. Yeah. So you see doctors playing with the kids. You see nurses playing with the kids when they have free time. Yeah, and then we have playrooms in the hospital which actually really allows children to have a safe space in such a scary environment. I think the playroom also supported like some development and normalcy. We increased their sense of normalcy and well-being while in the hospital. Yeah, I think we still do have challenges. I think when speaking to certain teams about our services, how we can advocate for them. Um, yeah, but I think definitely our voices are stronger now in the pediatric oncology team. We work with our surgical team too.
Have you found any tips or tricks to sort of when you're thinking about how you advocate for different children who are different ages? I suppose the language you use with them might be a little bit different. How do you think about how you're able to add your voice to give their voice more power?
Play is definitely child's language. Yeah, play is like a universal language for children, and it gives them the safe space and comfort to express whatever they want to. So even though I have foreign patients, I can't speak Vietnamese, I can't speak a lot of languages, but through play and especially using our body language, it truly helps us to connect with the child. And then I think through play, we also have that trust and able to maybe understand a bit more about how the child feels about certain things from their body language or facial expression. Yeah. And you definitely need creativity and a very huge willingness to play. Yeah, because it's a form of expression and their language, and it is important that we help them process emotions and experiences in a safe space, in a way that feels comfortable to them. Yeah. I wanted to also add that child life therapists, we use a lot of medical play. Yeah, so medical play involves like using real medical items to kind of open up the opportunity for children to experience and express how they feel or their own experience with medical items during the play. So we sometimes use a bear, we sometimes use a bunny, and these have actually like actual medical maybe central lines inserted into them. Yeah. So they can take blood, they can give medicine through the central line. We make it as real as possible. We also have like 3D models of machines, like the ultrasound machine or the MRI CT scan machine for children to play out also their experiences.
That's
Yeah.
really cool. It sounds like that would be really helpful. I'm just thinking for myself, even as an adult, that some of those things, if you haven't experienced them before, could be quite scary to actually have them in an environment where they can explore and play sounds like it would be really valuable.
Yeah, I think it's a very interesting thing because when I came in, I did not expect to see all this.
Certainly. And speaking of their well-being, this is quite a heavy topic to be working with people around cancer diagnoses and treatments. How do you take care of your own well-being?
I think this is heavy. Um, I think it's very sad every time I lose a patient. Emotions tend to, come up when you see siblings cry, you see parents cry. Sometimes it's screaming, sometimes it's really just not wanting to let go. I think it takes an emotional toll, definitely. Yeah, and I think as psychology students, you have to know that self-awareness and self-care is very crucial. Actually, I just recalled like personality psych actually helped me to reflect a lot more on who I am as a person. And that's how I felt brave enough to go into this role because I know I have enough internal resources to support myself. Yeah. So my organization, Children's Cancer Foundation, this variety of medical items that can be not so scary.
Yeah,
Yeah.
certainly.
They do provide us free counseling sessions a few times in a year. And then we have our own supervisors to go to whenever we face a death or we need any support in terms of our work. Yeah. And I think in terms of self-care, I try not to think about work at home. Yeah, just investing in my other many hobbies, reading, playing games, things like that. Yeah.
Yeah, I think that's great advice for all of us to really think about what things are that we enjoy doing and making sure that we take care of ourselves to be able to give our best selves to other people. I think that's a great note to end on. So, Mingri, thank you so much for joining me on the podcast today.
Thank you.
Thanks for listening to Professionally Psyched. This podcast wouldn't be possible without the ongoing support of our psych community. If you'd like to show your support or if you want us to cover anything on the pod, reach out via our emails, and don't forget you can listen to full episodes on Spotify.